Our guest from Prairie Lakes Healthcare System, Todd Hodenfield, is on the line. Todd, good morning.
Good morning, Mike. How are you, man?
I'm doing well. You are a physical therapist at Prairie Lakes Healthcare System. Before we talk about your job and your craft a little bit, tell us a little bit about yourself, where you're from, and how you ended up landing here in Watertown.
Yeah, I'm from North Dakota originally. Grew up in a small town, Ray, North Dakota, out in western North Dakota. Went to the University of North Dakota in Grand Forks and took up physical therapy there. After that, I moved to Minnesota for almost a decade, and then the good Lord brought my wife and our family to Watertown 3 years ago. We're really loving the community and really enjoying our time here.
The interesting thing, Todd, is that you and your wife are in similar but not identical lines of work, correct?
Correct. Yeah, she's an occupational therapist. She's a certified hand therapist, and then I'm a physical therapist, and I'm a board-certified orthopedic specialist.
So how do your two jobs differ?
I would say very similar in the sense of we try to create a great experience for patients that we encounter, and we treat a variety of conditions, but hers would be more focused on the upper quarter, like the shoulder, the elbow, the hand, the wrist, and mine would be a little bit more a global approach from neck pain to back pain, jaw pain, ankle pain, knee pain, anywhere between the head and the toes, I guess.
A lot of those pains evolve areas close to or in the joints, don't they? Why is that?
Yeah, sometimes we can have tissue injuries, and then therefore we'd have like joint pain and that type of stuff. And with that, oftentimes movement can be a good medicine, or getting stronger. And those things are things that we would think traditionally of getting better with physical therapy. And then on the other token, there'd be things that kind of persist or stay painful for longer than what we would anticipate. And then we maybe try a little different treatment approach here at Prairie Lakes in helping people get better with those type of ailments.
Now, you provide physical therapy resources for orthopedic patients. What would be the definition, Todd, of an orthopedic patient?
Yes, that'd be somebody who would have pain in their orthopedic joints or in their body, whether it's their back, their knee, what have you. And orthopedics would be the term for a joint, a bone. Yeah, a little bit of a nuance with that is I'm a board-certified orthopedic specialist, and that's one of the routes in physical therapy that you can do to specialize. There's a number of specialty areas, but that's the one that I chose that I feel it's a pretty broad area that encompasses a lot of people's pain journeys that they come in to see us for.
What is the total joint journey? Describe what that is, if you would.
Yeah, that's a great question. So when someone is planning to have a surgery at Prairie Lakes, we want to set that patient up for success. And so attending Joint Journey is one way to assist that. Joint Journey, it focuses on helping the patients better understand what to expect. And like I've come to appreciate, education is paramount in the healing process. And it starts with calming down the body and the nervous system even before the surgery takes place. And so Joint Journey focuses on setting the patient's expectation of what healing looks like and what patients can expect. Because a lot of times what we don't know can be fearful, and that fear can ramp up the pain experience. And so knowing what to expect helps combat that fear and then helps the patient succeed and have a good outcome.
That's very interesting. Yeah, that's a good description there. Todd, how does physical therapy and orthopedics, how do they work together?
Yeah, essentially, as a care team, we put the patient at the forefront. We collaborate with one another on a consistent basis. And essentially just, again, like I said, just putting the patient at the forefront. And so we are continually working with them, like I said, even before the surgeries, of trying to set them up to have a good experience and to live doing the things that they love to do, and till the end of their care here, when they're done with physical therapy or when they're done with their care here, we want to continue to help them do well by following up with them and just checking in on them.
What, if there is such a thing, what would a typical therapy session look like for someone who is recovering from an orthopedic procedure and then they land in your office and you start to go to work with them. What would a session look like?
Yeah, a typical care plan would be providing the patient with a thorough examination, both subjectively, so with questions and asking them a variety of things about themselves, getting to know them as well, because their past experiences and how they portray pain can influence pain, but also objectively of looking about how they move and how strong they are, etc. And with that plan, I feel within that listening intently is exceptionally important from the very first handshake of when I meet them in the waiting room and those first interactions that I have with them. With that care plan, we strive to focus on the patient's goals and their desires. And that looks a little different for everybody, right? But within that, the goal is to create an environment where we have fun, laugh. I oftentimes give high fives, and we develop a trust with one another. And that's what I would say a typical care plan looks like, of trying to focus on the patient and their goals and doing a good job to meet their needs. Walking with them and being with them, of doing our best to get done what they need to get done, of what they want to accomplish, whether it's picking up their grandkid, whether it's going golfing, whether it's being able to go up and down the stairs, garden, what have you. We want to help them. We want to be at their aid to get them better to do those things that they love to do.
Sounds like it's a team approach where you try and build confidence in each other to get the job done.
Amen. Yes, absolutely.
Todd, what is the Pain Science Center?
Yeah, so the Pain Science Center is somewhat of a new program here at Prairie Lakes, and it's a little bit of a different approach to tackling, if you could use that word, pain, of helping to tame that pain that people have going on. And so what we know about pain is it isn't always about boom, ow, it hurts, or you sprain your ankle, it hurts. It's more in-depth than that, of tissue things that occur aren't always the driver of what we're feeling, that there's other things that can be included in the healing process, including our thoughts and our emotions and even our expectations. And it's just taking a little bit of a different approach to helping people understand their pain and to maybe challenge their thoughts and beliefs about their pain that they're currently having by exploring kind of the deeper meaning of that pain with what they share with me. And that's why I feel like earlier what I said of developing a trust is really critical, because them sharing what they have going on, some of those things of their anxieties or their thoughts and their emotions can really play part into the pain that they're experiencing. So just trying to take a little different approach in that respect and looking at how to help them move easier, to sleep better, maybe to eat a little cleaner, and just looking at pain from that perspective.
Is there a certain type of injury or a condition that you see more frequently than others?
I'd say it's quite variable, although in the nitty-gritty of it, I would say low back pain is very common, and I'd say that's probably one of the most familiar and most outstanding things that people come into physical therapy for here at Prairie Lakes. It's anything from headaches to jaw pain, their knee bothers them, their shoulders irritated. It's a pretty wide gamut of injuries or ailments that people come in to physical therapy for, and so it's good variety. It's fun to have that variety too, because it's always changing, and it keeps you on your feet and it keeps you on your toes. And then with that, you're working with people and their personalities and how they go about their day-to-day things also is part of that process of trying to fine-tune how you can help them best.
If you have pain in a certain part of the body and you're not getting it addressed and you're not trying to get it fixed, can it radiate and expand and start impacting other parts of the body too?
Yeah, absolutely. And there's a couple reasons why that would be happening. There's a noisy neighbors example that we talk about, of sometimes, say, if your neighbor called the cops and they said, my neighbor's being really noisy, and so the cops go and check out that neighbor, and you've done that multiple times this month. And so then another person in the area calls on their neighbor and says, hey, my neighbor's being noisy. Can you come check him out? If the cops are in the area of your neighborhood, of that person that's already called the cops multiple times, then they might just go in that area and check in on that area because it's bothered you before. And so the immune system of what drives our pain and the nervous system of what is central to our pain experience, it's super smart and it's very intricate and good at what it does. And so if there's an area that you've prior hurt or had an injury, the immune system, even if your hip is now hurting, will go sprinkle immunity on your knee if it's hurt before, because it's that smart, and it always reminds us of prior things, because in our brains we have the memory of those things. We call them neuro tags. And so the brain and the body and the whole human experience of pain is very interwoven and pretty beautiful. And pain can be looked at as maybe sometimes as oh shoot, I have pain, that's bad. But I would argue we should almost be grateful for our pain, because pain can be a really good helper. And it just shows the power of the body, of how beautiful, like I said, that immune system in our body is.
Do you work, and a lot of the patients that you work with are suffering, like you mentioned at the top of the interview, from pain in the joints, whether it be the shoulder, the knee, the hip, the ankle. Do you work with patients where you get to a point where therapy, you've done as much as you can with a patient, and maybe it's time for that patient to look at, for example, a knee replacement, hip replacement, and then conversely, do you have patients that have undergone a joint replacement surgery and then they land in your office and you work with them on rehabbing?
Yeah, so there's definitely a time and a place for joint replacement after, I would say, trying physical therapy and working through physical therapy and trying to get stronger and get more flexible. And then, yeah, absolutely, after surgery, people come in after their joint replacements or after their rotator cuff repairs, back surgeries, what have you, to rehab and to work on getting stronger and moving easier in a linear progression that's taken by a rehab process called like a protocol or a science-based, evidence-based approach.
As we age, Todd, of course, our range of motion, our flexibility, our strength seems to decrease over time. How important is it as we age to try and do some exercise, maintain, if not build, at least maintain our strength and flexibility?
Yeah, there's an old adage saying you can't go wrong with getting strong. I don't know if you've heard that, and I think there's definitely something to that. And you're hitting the nail on the head, Mike. As we age, we all experience something called sarcopenia. It's basically muscle atrophy, or where the muscles become weaker, and that's a normal part of aging. And essentially, movement and exercise can help prevent this decline. And with that, strength training or movement is part of that, but so is gardening. So if you're gardening, keep gardening. If you're doing the stairs at your house, keep doing the stairs. Keep staying active and going on your walks. Essentially, keep moving, because movement is medicine.
Indeed. Todd, what advice would you give to folks out there who may be dealing with some joint pain or limited mobility and they haven't been to a physical therapist yet?
Yeah, I would say there is hope, and don't give up on that. If you're finding yourself having a difficult time or needing a hand, reach out here at Prairie Lakes Healthcare System. We're going to do our best, as hopefully you can hear through the words that I'm using today. We're going to do our best to get you back to the things that you love to do, and we look forward to that. We, here in our therapy department, really love hanging out with people and getting to know people and working with people here.
How do they reach you, Todd, at the hospital there?
Yeah, that'd be 605-882-7700.
882-7700. Very good. Todd, good to visit with you. Thanks for your time, and good luck there at Prairie Lakes. It was nice to visit today.
Hey, you too. You take care, Mike. Thanks a lot, man.
Yeah, bye-bye. Todd Hodenfield. He is a physical therapist and works with orthopedic patients here in Watertown at Prairie Lakes Hospital.